Hello everyone, welcome to our YouTube channel. I am Dr. Nisha Bhatnagar, Medical Director, Aveya Fertility and IVF Center. Today we are going to talk about a very important topic, that is ICSI. It is intra-cytoplasmic sperm injection, commonly known as ICSI. So today I have with me Harshit Aliyan. He is the Scientific Director of Aveya Fertility and IVF Center. He has done his Masters in Clinical Embryology from Manipal University. Also, he has done his practical training in Naples, Italy. Welcome, Harshit.
Thank you, Dr. Nisha.
So, Harshit, let's begin by explaining what is ICSI.
Okay, so ICSI, which is also called as intra-cytoplasmic sperm injection, is a specialized form of IVF procedure.
What is the difference between IVF and ICSI?
Yes, so in case of conventional IVF, what happens is there are thousands of sperms. We put thousands of sperms in between the egg and we keep it in a petri dish. Okay. So what happens here is the sperm, by the natural selection, goes near the egg and the fertilization occurs on its own. Okay. So this is basically called as conventional IVF.
Okay. And in ICSI, basically, you are selecting the sperm. Okay.
Exactly, yes. In ICSI, we embryologists select a particular sperm based on the morphological observations. We use high magnification microscopes under which we select the normally good looking sperm and inject it into an egg.
Okay, so looks do come into play.
Yeah, so this is the difference. This is the basic difference between ICSI and IVF.
Okay. So Harshit, do you need any special preparation for ICSI, like a day prior or something?
Yes, before we start going for ICSI, there is something called as sperm preparation. So what happens is the male partner gives the semen in the andrology lab, and this semen undergoes a series of washing procedures, which is also called a swim up or density gradient, to remove the bad quality sperms from the high quality sperms. So once this procedure is carried out, we get the high quality sperms out of the low quality ones. These sperms are then morphologically observed under the high magnification microscope, and the best sperm is selected out of it for ICSI.
So Harshit, how do you decide which case is for IVF and which is for ICSI?
So ICSI, we would recommend ICSI for patients with severe male factor infertility. Okay. That includes if the sperm count is very less, if the motility is very less, or the morphology is very bad. We also recommend ICSI for patients whose eggs are already frozen. Okay. And they have to undergo a cycle. So we thaw the eggs and then do ICSI with those frozen eggs.
Why do the frozen eggs need ICSI only?
So in case of IVF, we put the sperms around the eggs which has a cumulus covering around it. Okay. But once the eggs are frozen, there is no cumulus covering the eggs, so we cannot do IVF for those patients. So ICSI is the preferred line of treatment in such patients.
Harshit, okay, tell me one thing. If a patient has few sperms but they are not motile, how do you know that they are live, and how do you select that sperm for injecting?
Yeah, so what happens is when there is low motility, or if there is no motility seen in the semen sample, there is certain chemicals which can be used to enhance the motility of these spermatozoa. There are different kinds of these chemicals available in market. Some of them are pentoxyphylline, or there is different tests called as HOS test, which is also called as hypoosmotic swelling test. These tests, what happens is when the sperm interacts with these chemicals, there is a twitching movement of the sperms which happens due to a chemical reaction, and those sperms are then selected for ICSI.
Oh, you mean to say that even if the motility is very less or the count is very less, ICSI is the procedure with the help of which the patient can get the genetic baby of their own.
Right. That's the main thing. When there is low motility or something, we have certain advancements, and by those advancements we can do ICSI as the primary treatment.
So Harshit, once you have done ICSI, what happens next? What do you do?
Yeah, so once the ICSI is done, there is something called as fertilization check. So this fertilization check happens on the next day of the ICSI. So what we do is we check for the normal fertilization of a single sperm into a single egg. So this is observed by something called as pronucleus and polar bodies. There should be two pronucleus and two polar bodies. That means that proper fertilization has occurred in that egg.
And then you grow the embryo, take it to day 3
Yes,
and
then,
day 5.
then there is a series of screening procedure which happens on day 3, day 5. We check for the grade. We check for the grade of the embryos, how the embryos are growing. We check for the cell number. We check for the symmetry of the egg. We also check for the fragmentation. So all these things taken into consideration, we give a grade for the embryo. So once that is done, on day 5, if there is a good quality blastocyst formed, we either transfer it back into the female uterus or we freeze it.
Do you prefer IVF or ICSI?
So again, it depends on case to case basis. So if there is a severe male factor infertility, then I would obviously go for ICSI. But in cases of normal male factor, and if only the female has some tubal block or something, then we can go ahead with IVF.
So what is your experience, Harshit? Is there increased risk for ICSI?
There is no such major risk involved in ICSI, but sporadic reports say that there is slight higher chance of genetic mutations which occur during the ICSIs, but there is it's not yet proven. So
also, Harshit, you need to remember that these are infertile couple. They coming to you with very low count, very low motility. There might be some reason in the genetic structure itself.
Exactly.
So that's why we can't put it on the procedure itself.
Yes.
So that was really a very informative session, and thanks a lot for coming and giving us this informative talk. If you have any other questions about ICSI or you want to understand any other thing about the procedure, please feel free to contact us on the given number. Thank you so much. Bye for now.